Are you suffering from sciatic nerve pain that runs down your leg and can't find lasting relief? If you're over 60, 70, or 80, you need to understand that some seemingly harmless habits can be completely sabotaging your recovery and dramatically intensifying your pain. Today, I'll reveal the 8 most dangerous habits people your age commit daily, which turn manageable pain into constant torment that can even compromise your independence and quality of life. I'd love to hear where you're watching from today. Leave a comment below telling me where you're from and how long you've been living with sciatic pain. And don't forget to subscribe to the channel and turn on notifications so you don't miss any valuable tips on how to overcome sciatic nerve pain once and for all. The sciatic nerve is the largest and longest nerve in the human body, originating in the lumbar region between the L4 and S3 vertebrae, passing through the glutes, down the back of the thigh, and reaching the feet, approximately 2 centimeters wide at its origin. This nerve controls most of the leg muscles and provides sensation to virtually the entire lower extremity. When this nerve is compressed, irritated, or inflamed, the result is the well-known sciatic pain, which can range from mild discomfort to excruciating, debilitating pain. Statistically, sciatic pain affects about 40% of people over the age of 60, but when we talk specifically about people over 60, that percentage jumps to a staggering 60% to 70%. This happens because the natural aging process brings significant changes to the structure of the spine, including narrowing of the intervertebral spaces, degeneration of the discs, thickening of the ligaments, and the formation of osteophytes, popularly known as parrot's beaks. For older adults, sciatica isn't just a matter of physical discomfort. It poses a real threat to the independence, mobility, and autonomy they value so much. Pain can limit basic activities such as walking, climbing stairs, getting up from a chair, or even standing for prolonged periods. Furthermore, the constant fear of pain can lead to a sedentary lifestyle, which in turn accelerates the loss of muscle mass, strength, and flexibility, creating an extremely damaging vicious cycle. What makes the situation even more worrying is that many people in this age group develop compensatory habits in an attempt to alleviate pain, but which actually end up perpetuating and intensifying the problem. These habits, seemingly logical from the perspective of immediate relief, can cause muscle imbalances, permanent postural changes, and strain on other structures of the spine and lower limbs. The good news is that identifying and correcting these harmful habits can result in significant improvement in sciatic pain, even in people over 60, 70, or 80. Several studies show that simple behavioral interventions, when applied consistently, can reduce pain intensity by up to 70% and improve functionality in over 80% of cases. Today, you'll discover exactly which 8 dangerous habits could be sabotaging your recovery. Each of these habits will be explained in detail, showing how it specifically affects the sciatic nerve, why it's even more harmful for people your age, and most importantly, how you can correct it immediately to start experiencing real, lasting relief. It's important to understand that correcting these habits doesn't require complex movements or expensive equipment. Everything you need is within your reach, always respecting your individual limitations and capabilities. The goal is to restore the freedom of movement and quality of life you deserve, regardless of your age. Let's begin by revealing the first devastating habits that people over 60 commit daily, which turn sciatic pain into a nightmare. These early habits are particularly insidious because they seem logical and even beneficial at first glance, but in reality, they are causing progressive damage to your sciatic nerve. This is probably the most common and devastating habit among seniors. After 60, it's natural to want more rest, especially when you're in pain. A comfortable chair or sofa may seem to offer the relief you seek, but in reality, it's creating a deadly biomechanical trap for your sciatic nerve. When you sit for prolonged periods, especially on soft seats like armchairs and sofas, several harmful changes occur simultaneously in your spine. First, intradiscal pressure increases by up to 300% compared to standing. This means that the intervertebral discs, which are already naturally more dehydrated and fragile after age 60, are compressed 3 times more forcefully. accelerating their degeneration and increasing the risk of protrusions or herniations that can directly compress the sciatic nerve. Furthermore, prolonged sitting causes progressive shortening of the hip flexor muscles, particularly the iliac psoas. For people over 60 who already have a natural tendency toward muscle stiffness due to changes in collagen and elastin, this shortening becomes even more pronounced and detrimental. The shortened psoas muscle constantly pulls the lower back forward, increasing lumbar lordosis and creating additional pressure on the nerve roots that form the sciatic nerve. The situation is aggravated when we consider that armchairs and sofas rarely offer adequate support for the spine's natural curvature. These pieces of furniture are designed for immediate comfort, not postural health. The result is that your spine assumes a position of excessive flexion, stretching the posterior spinal ligaments and creating segmental instability. This instability forces the paraspinal muscles to work constantly to maintain stability, leading to muscle fatigue and the formation of tension points that can radiate pain along the sciatic nerve. The second extremely harmful habit is related to how you position your head while sleeping. Many people over 60 believe that high pillows provide greater comfort and better breathing, especially those who have developed respiratory problems or gastroesophageal reflux. However, excessively high pillows create a cascade of postural problems that culminate in sciatic nerve irritation. When you use a pillow that's too high, your head is projected forward, creating compensatory cervical hyperlordosis. This change in the cervical spine forces the entire spine to seek a new postural balance. To compensate for the forward position of the head, the thoracic region projects backward, increasing kyphosis, while the lumbar region projects forward, further increasing lumbar lordosis. This global misalignment of the spine during the 6 to 8 hours of sleep creates asymmetrical tensions throughout the paraspinal muscles. For older adults, whose tissues have a lower capacity for recovery and a greater tendency toward stiffness, these tensions accumulate night after night, creating patterns of dysfunction that perpetuate throughout the day. Excessive lumbar lordosis caused by a high pillow further narrows the intervertebral foramina, the spaces through which the nerve roots that form the sciatic nerve pass. In people over 60, who may already have narrowing of these spaces due to osteoarthritis and osteophyte formation, any further reduction can be enough to cause nerve compression and radiating pain. Furthermore, improper head position during sleep directly affects the quality of rest. Studies show that postural changes during sleep reduce the efficiency of deep sleep phases, crucial periods for tissue recovery and inflammation reduction. For people with sciatic pain, this reduction in sleep quality compromises the natural mechanisms of neural repair and regeneration. The third devastating habit may seem distant from sciatica, but it's actually directly connected through the kinetic chain of movement. Many people over 60 continue to wear shoes that were comfortable years ago, unaware that their feet have undergone significant changes with aging, including widening, flattening of the arch, and the development of deformities such as bunions and claw toes. Tight or ill-fitting shoes force the feet into abnormal positions during gait. This change in foot biomechanics propagates upward through the kinetic chain, affecting the ankles, knees, hips, and ultimately the lumbar spine. For older adults who already have reduced flexibility and adaptability, these compensations become fixed and progressively detrimental. When your feet can't adequately absorb impact and propel you while walking, your upper body must compensate. The hips, which should move freely in all three planes of motion, become restricted, creating asymmetrical tension in the gluteal and piriformis muscles. The piriformis muscle, located deep in the gluteus, has a close anatomical relationship with the sciatic nerve. In approximately 15% to 20% of the population, the sciatic nerve passes directly through the piriformis muscle, while in most people, it passes just below it. When ill-fitting footwear alters hip biomechanics, the piriformis muscle can go into chronic spasm, compressing or directly irritating the sciatic nerve, causing piriformis syndrome. For people over 60, this situation is even more serious because the capacity for neural regeneration is naturally diminished. This means that irritations that might be temporary in younger people tend to become chronic and progressive in old age. Now we'll reveal the next dangerous habits that are silently destroying your neural health and perpetuating your sciatic pain. These habits are even more insidious because they're often recommended by well-intentioned people or even adopted as self-care strategies, but they're actually causing cumulative damage to your nervous system. This seemingly innocent habit is extremely common among older adults and represents one of the most underestimated causes of worsening sciatic pain. You probably have the habit of always carrying your purse, shopping bag, or other objects on the same side of your body, usually your dominant side. This repetitive pattern, maintained over decades, creates progressive muscle imbalances that become especially problematic after age 60. When you consistently carry weight on one side, your body is forced to make constant postural compensations to maintain balance. The weight-bearing side develops a tendency toward shoulder elevation and lateral spinal tilt. To maintain balance, the opposite side must compensate by creating an S curvature in the spine. This compensatory curvature directly affects the lower back, creating asymmetrical pressures on the intervertebral discs and neural structures. For people over 60, whose discs already show natural signs of degeneration and dehydration, these asymmetrical pressures dramatically accelerate the process of disc deterioration, increasing the risk of protrusions and herniations that can compress the sciatic nerve roots. Furthermore, chronic postural imbalance overloads the deep stabilizing muscles of the spine, particularly the multifidus and rotator cuff muscles. These small but crucial muscles are responsible for segmental control of the spine. When chronically fatigued, they lose their ability to stabilize precisely, allowing excessive micro-movements between the vertebrae that can irritate adjacent neural structures. The situation is exacerbated when we consider that older people naturally lose muscle mass through a process called sarcopenia. This muscle loss primarily affects fast-twitch fibers, which are essential for stabilization responses. When combined with imbalances caused by unilateral loading, the result is progressive instability of the lumbar spine that can manifest as chronic sciatic pain. The fifth devastating habit is related to sleep patterns you've maintained for decades without realizing how they're affecting your neural health. Many people over 60 develop a preferred sleeping position and stick to it rigidly every night, whether out of habit, fear of increased pain, or mobility limitations that have developed over time. Sleeping consistently in the same position, especially without adequate support, creates sustained tension in specific structures throughout the entire sleep period. If you consistently sleep on your side without a pillow between your legs, for example, you're creating a sustained pelvic rotation that strains the sacroiliac ligaments and can compress the lower sciatic nerve roots. The sideways position without adequate support also causes the upper leg to fall over the lower leg, creating forced hip adduction. This position overstretches the hip abductor muscles, including the gluteus medius and minimus, muscles essential for pelvic stability during walking. For older adults who are already prone to muscle weakness due to a sedentary lifestyle and sarcopenia, this prolonged nocturnal tension can result in neural inhibition and even greater weakness. If you prefer to sleep on your stomach, you're creating excessive lumbar extension that can compress the posterior joints of the spine, richly innervated structures that can generate referred pain along the sciatic nerve. This position also forces a maintained cervical rotation to allow breathing, creating tension that propagates throughout the body's posterior chain. Sleeping on your back without adequate knee support keeps your hip flexor muscles in a tight position throughout the night. For people over 60, who already tend to have tight hip flexors due to prolonged sitting during the day, this nighttime position perpetuates and intensifies the problem, creating constant anterior traction on the lower back. The sixth, extremely dangerous habit involves the way you perform basic postural transitions in your daily life. Many people over 60, especially when experiencing pain, develop the habit of making sudden compensatory movements in an attempt to quickly escape from uncomfortable positions. This behavior, while understandable from the perspective of immediate pain relief, causes repetitive microtraumas that perpetuate and intensify the sciatic problem. When you abruptly get out of bed in the morning, you subject your spine to extreme acceleration and deceleration forces at a time when the tissues are at their most vulnerable. During sleep, the intervertebral discs partially rehydrate through a process of osmotic imbibition, increasing their height and altering their mechanical properties. At the same time, the muscles and ligaments remain in a state of relaxation for hours, temporarily losing their protective response capacity. Sudden movements in this context can cause microscopic tears in the fibers of the annulus fibrosus of the intervertebral discs, accelerating disc degeneration and increasing the risk of protrusions or herniations. For older adults whose tissues have a lower capacity for repair and regeneration, These micro-traumas accumulate over time, leading to progressive degeneration. Furthermore, sudden movements during lifting activate protective reflexes that can cause sudden, asymmetrical muscle contractions. These protective muscle spasms, while initially beneficial, can become chronic and contribute to dysfunctional movement patterns that perpetuate sciatic pain. The situation is even more serious when you consider that people over 60 often experience orthostatic hypotension, a condition in which blood pressure drops rapidly with sudden postural changes. This drop in pressure can cause dizziness or lightheadedness that increase the risk of falls, creating a cycle of fear and even more damaging postural compensations. Now we come to the final and perhaps most devastating habits that people over 60 commit daily without realizing the catastrophic impact on their sciatic pain. These last habits are particularly insidious because they are often accepted as normal for their age or even encouraged by well-meaning family members and caregivers. This is probably the most destructive habit of all, creating a vicious cycle that turns manageable pain into progressive disability. When you experience sciatica, your natural reaction is to avoid movements that might trigger or intensify the discomfort. This response, known as fear-related avoidance behavior, seems logical in the short term, but it's literally destroying your ability to recover. For people over 60, the fear of pain becomes even more powerful because it's accompanied by the fear of falling, loss of independence, and functional deterioration. This combined fear leads to what experts call disuse syndrome, where muscles, joints, and neural systems deteriorate rapidly due to lack of adequate stimulation. When you avoid physical activity, your muscles begin to lose strength and mass at an alarming rate. After age 60, muscle mass loss can reach 3% per year when combined with a sedentary lifestyle. The deep stabilizing muscles of the spine, essential for protecting the sciatic nerve, are the first to be affected. Muscles such as the transversus abdominis, multifidus, and diaphragm lose their ability to coordinate co-contraction, leaving the spine vulnerable to movements that can irritate the sciatic nerve. Inactivity also dramatically affects local blood circulation. The sciatic nerve, like any neural tissue, depends on an adequate blood supply to maintain its health and function. When you become sedentary, circulation in the lower back and gluteal region decreases significantly, reducing the supply of oxygen and nutrients essential for neural recovery. Simultaneously, the removal of toxic metabolic products is impaired, creating a chronic inflammatory environment that perpetuates pain. Furthermore, prolonged immobility alters the mechanics of neural tissues. The sciatic nerve needs to glide and stretch normally during hip and knee movements. When you avoid these movements, adhesions can form between the nerve and surrounding tissues, a process called perineural fibrosis. These adhesions restrict the nerve's normal mobility, causing tension and irritation whenever you try to move. The eighth and final devastating habit is the exclusive reliance on pain medications, especially non-steroidal anti-inflammatory drugs and analgesics, without seeking other therapeutic strategies or appropriate medical advice. This habit is extremely common among older adults who often have easy access to over-the-counter medications or maintain old prescriptions without regular medical follow-up. For people over 60, the indiscriminate use of anti-inflammatory drugs poses especially serious risks. The renal system naturally loses efficiency with aging, and anti-inflammatory drugs can cause further deterioration of kidney function, especially when used chronically. Furthermore, these medications significantly increase the risk of gastric ulcers, digestive bleeding, and cardiovascular problems in people in this age group. More importantly, chronic use of these medications creates a false sense of control over the problem. You may experience temporary pain relief, but the medications aren't addressing the underlying causes of sciatic nerve compression or irritation. In fact, they may be masking important signs of worsening that should prompt behavioral changes or seeking specialized treatment. Medication dependence also interferes with your body's natural pain-modulating mechanisms. The nervous system has sophisticated endogenous mechanisms to control pain perception, including the release of endorphins and the activation of descending inhibitory pathways. Chronic analgesic use can suppress these natural systems, creating an increasing dependence on external interventions for pain control. Furthermore, many people in this age group combine multiple medications without proper medical supervision, creating dangerous drug interactions. Anti-inflammatories can potentiate the effects of blood thinners, increase the toxicity of other medications processed by the kidneys, and interfere with blood pressure medications, creating significant cardiovascular risks. The most worrying thing is that focusing exclusively on medication prevents you from exploring truly effective and safe therapeutic strategies for your age group. Techniques such as specific postural education, neural mobility exercises, progressive strengthening, and environmental modifications can be far more effective in the long term than any medication, especially when applied consistently and progressively. Recent studies demonstrate that multimodal approaches, which combine pain education, specific exercises, relaxation techniques, and behavioral modifications, are superior to pharmacological treatment alone for chronic sciatic pain in older adults. These approaches not only provide more lasting relief, but also improve overall functionality, sleep quality, and feelings of self-efficacy in managing the condition. Correcting these 8 devastating habits means the difference between a life limited by pain and a full and active life, regardless of your age. Each habit you correct removes a source of irritation and overload from your sciatic nerve, allowing its natural recovery mechanisms to function properly. Correcting these 8 devastating habits shouldn't be done abruptly or all at once, especially if you're over 60, 70, or 80. Your body needs time to adapt to the changes, and a gradual, progressive approach is essential to avoid overload and ensure lasting results. Start by implementing just 1 or 2 habits per week, allowing your nervous and musculoskeletal systems to adapt before introducing new changes. It's crucial to understand that people your age have different adaptive capacities than younger people. This doesn't mean you can't dramatically improve your condition, but rather that the process requires patience, consistency, and respect for your individual limits. Each small change you implement will contribute to a significant cumulative result over time. Keep in mind that your experience with sciatica may be related not only to the habits we've discussed, but also to specific medical conditions such as spinal stenosis, advanced facet joint osteoarthritis, or segmental instability. Therefore, it's crucial to maintain regular medical follow-up and inform your doctor about any changes you're making to your routine. Proper hydration becomes even more critical as you age. Drink at least 8 glasses of water a day, as dehydration can intensify joint and muscle stiffness, worsening your sciatic pain. Also, maintain a diet rich in anti-inflammatory nutrients like omega-3s, found in fish like salmon and sardines, and antioxidants found in berries and dark green leafy vegetables. Your living environment also needs to be adapted to support these new healthy habits. Make sure your home has adequate lighting to avoid sudden movements due to poor vision, non-slip rugs to prevent falls, and furniture at an appropriate height to facilitate smooth postural transitions. There are specific situations where you should be extra careful when implementing these changes. If you have a history of frequent falls, severe osteoporosis, significant heart problems, or take medications that affect balance, such as sedatives or some antihypertensives, all postural and movement modifications should be implemented very gradually and preferably under professional supervision. People with diabetes require special attention, as diabetic neuropathy can mask signs of injury or overuse, and the healing of potential microtears may be compromised. If you have diabetes, carefully monitor any changes in sensation in your feet and legs while you're correcting your habits. If you take blood thinners like warfarin or antiplatelet medications, avoid vigorous massages of the lower back and glutes, as they can cause bruising. Gentle self-massage techniques with light movements are safe and beneficial. Never ignore warning signs such as sudden loss of leg strength, changes in bladder or bowel control, or pain that worsens despite corrective measures. These may be signs of severe nerve compression that require immediate medical evaluation. Seek immediate medical attention if you experience loss of bladder or bowel control, which may indicate cauda equina syndrome, a neurosurgical emergency. Also, seek urgent help if you experience progressive loss of leg strength, especially if it affects your ability to walk or stand. Pain that wakes you from sleep and doesn't improve with position changes may indicate non-mechanical causes such as tumors or infections, especially if accompanied by fever or unexplained weight loss. These symptoms require immediate medical investigation. If you have implemented habit corrections for more than 6 weeks without any improvement in pain intensity or frequency, it is important to seek specialized evaluation to investigate other possible causes or the need for additional interventions such as specific physical therapy or minimally invasive procedures. Always start by correcting your sleeping and resting habits, as these are the safest and provide immediate benefits. Adjust your pillow height and use support pillows between your legs if you sleep on your side. Implement regular periods of movement throughout the day, getting up every 30 minutes, even if only for 1 to 2 minutes. Week by week, add new corrections, always respecting your pace and limitations. Document your progress in a simple diary, recording pain levels, sleep quality, and functional capacity for basic activities. If this video was helpful and shed light on the habits that may be sabotaging your sciatica recovery, please click the like button. Your like helps me understand that this content is truly making a difference in the lives of people like you. Leave a detailed comment below sharing your experience with sciatic nerve pain. How long have you been living with this pain? How many of these 8 habits have you identified in your routine? Which one do you think is affecting your condition the most? Your story can help others going through the same situation and help me create content even more tailored to your needs. If you haven't already subscribed to the channel, do so now and turn on notifications by clicking the bell. This way, you'll immediately receive all new videos on proven strategies to permanently overcome sciatic nerve pain, especially content developed with the specific needs of people over 60 in mind. Share this video with someone you know who also suffers from sciatica. It could be a family member, friend, or neighbor. People in this age group often don't have easy access to up-to-date information on pain management, and sharing this video could literally transform someone's quality of life. And let me know in the comments what specific topic about the sciatic nerve you'd like to see in the next video. Would you like to see specific and safe exercises for your age group, self-massage techniques, home adaptations to prevent sciatic pain, foods that combat neural inflammation? Your suggestions are crucial for me to continue creating content that truly meets your needs. Remember, your age isn't a limitation. It's an opportunity to apply wisdom and experience to achieving a pain-free life. You have all the knowledge you need now, you just need to take the first step. Your journey toward lasting sciatic pain relief begins today by correcting the first habit. Don't wait any longer. Your quality of life and independence depend on the decisions you make now.